Alright, in this video we're going to cover congestive heart failure and procedures. And if you haven't watched the videos for the cardiac defects for increased blood flow or decreased or mixed, do that prior to this video because congestive heart failure in children is related or cause of those other defects. So in order to understand some of these procedures in congestive heart failure, you're going to want to understand why they got it in the first place. So with congestive heart failure, impaired myocardial function, tachycardia, fatigue, weakness, restlessness, pale, cool extremities, decreased blood pressure, decreased urinary output. So CHF in children, same clinical manifestations as adults. The cause is different, so the cause will depend on the heart defect. Pulmonary congestion versus systemic venous congestion. And so this may depend on which type of anomaly that they have or defect that they have, whether it's transposition of the great vessels, whether it's a patent ductus arteriosus, or the foramen valley has not closed, resulting in an atrial septal defect. Then you have the increased pulmonary blood flow, and then the congestive heart failure with all the fluid. So with surgical intervention is what's needed for these defects. So these cardiac catheter procedures in children can correct transposition of the great vessels, some single ventricle defects, atrial septal defect, pulmonary artery stenosis. This is just a picture of the interventional cardiac catheter procedures in children, how this might correct the pulmonary stenosis, going through the inferior vena cava or superior vena cava into the right atrium, through the tricuspid valve, and then correcting the pulmonary valve. So important to note with cardiac catheter procedures in children, you're preparing the child and the family for the procedure. You're using developmentally appropriate materials to explain the procedure to the child. You may be using child books or children books that are illustrating the procedure before. You're going to assess and mark pulses, baseline oxygen saturation, and of course NPO. Post-procedural care, you're also going to assess and mark the pulses, make sure that the pulses have returned. You're monitoring temperature, color of extremities, oxygen saturation, of course blood pressure, monitor dressing for bleeding or hematoma. You're monitoring your intake and output, and you're monitoring blood glucose levels. After the child returns from cardiac catheterization, the nurse monitors the child's vital signs. For how many seconds should the heart rate be counted? If you did not answer 60 seconds, then email me and we'll have a chat about correct vital signs in children. So some of the surgical interventions in children, you'll have open heart surgery. The closed heart surgeries would be for those minor dilation, pulmonary stenosis, aortic stenosis, those things that can be easily done. Actually, aortic stenosis, if you're doing a complete valve replacement, that would be open heart. And then you're doing the procedures in stages. You're preparing the child and the family for the procedure outlined developmentally. Post-pericardiotomy syndrome. So this is, the cause is unknown, but this is just occurs post-op, day 7 to 21, and it can occur immediately in the post-operative period. The theories are an autoimmune response or reaction to blood in the pericardium. It does require further intervention, such as a pericardiocentesis or pleurocentesis. The child can have fever, pericardial friction rub, and that's what you are doing a full assessment, a cardiovascular assessment post-op to assess those items. Further information is in your book regarding procedures and care for the post-op cardiac area.